February is a month for love. It's also American Heart Month. The Cleveland Clinic is researching how many Americans are using technology to improve heart health and how they feel about AI in regards to their health care. A survey the clinic has just recently done has had surprising results. Joining us live is cardiologist Dr. Emanuel Finet. He's got details about Cleveland Clinic's 2024 Heart Health Survey. Doctor, thanks for joining us.
Thank you for inviting me in the program.
So what's the #1 headline from your survey?
So this year's survey, about 1,000 individuals were surveyed, and the vast majority of them have these devices to monitor their health parameters, either wearable devices, and they utilize them to actually track how they are doing in terms of their health. They track their steps, their pulses, they track their calories and how much they consume. They believe that this is going to improve their cardiovascular health and the ones of the population. And they're also able to share that with us for us to make medical decisions. So that's been actually very good.
So that is helpful. It does actually, in a way, I guess, improve your cardiovascular health just by keeping an eye on it and then relaying any information that might raise a few question marks with your doctor or healthcare provider.
Well, what these devices do clearly is like a scale that we have at home to monitor our weight, right? It just tells us what the problem is, it keeps us accountable, it keeps us motivated, but they don't really treat. Then that information needs to be shared with our physicians, and then they can actually validate the data and try to act upon it. So it's important to understand that this is complementary to a caring physician and not a replacement.
Nonetheless, do you think that most of us should give it a try? Would it be helpful to us in the long run?
I think it has to be customized. I don't think necessarily it should be applied throughout the population. Clearly, not everybody has access to this, but it is very helpful on patients that already have it to be able to track what their activity is and how much they are eating, and try to build on those, healthy cardiovascular habits that we ought to have, like losing weight and exercising more and lowering our blood pressure and not smoking and so forth. So that is very important. And also for patients that do already have cardiovascular disease, for example, arrhythmias, it is very helpful many times when they have these devices because they're able to track on their daily lives what their symptoms correlate with their pulse, for example. And even some of them can do full electrocardiograms through some of these devices, and they can share that to us. So in those particular cases, I would say it's even much more helpful to really catch things that otherwise they would be missed.
Boy, a great time to have you on our program. Thank you so much for joining us, Dr. Emanuel Finet from the Cleveland Clinic. Have a great day.